Welcome to my podcast. I'm just going to follow up to the previous case about joint replacement. So basically, the patient that had undergo a joint replacement, whether it's the knee or the hip. So there is basically, in general, you need to check for the patient post-operatively. So you need to check if there is any sign or symptom of infection, like fever, discharge from the area, if there is any chest pain, shortness of breath, which could point out to DVT. And also, if there is any too much pain around the area, which could imply this will, of course, occur in certain period of time. It won't occur possibly immediately. And also, you need to inquire about any persistent pain or numbness in the area. So basically, the general information that you will give to the patient, of course, they will undergo physiotherapy, but there is certain precaution that you need to give to the patient after such procedures. For instance, like avoid bending down, also avoid bending more than 90 degree in any activity, avoid twisting the hip, not stand on one side for a prolonged period of time, and when to turn around, ask the patient to take it in small steps rather than a big one. Also, to ask the patient when they lie on the side of the operation, they should avoid lying on that side and avoid any pressure in the area. Also, avoid to cross legs on each other and not to force the hip, and avoid a low chair or low seat. So a high toilet seat is not favorable. And also to avoid falls and take an extra precaution in order not to damage the hip. And also, you will give the patient crutches to help them in the walk for the first couple of weeks. And also, you need to give extra care in any slippery places, like, for instance, the kitchen or the bathroom or the stairs, because there is a high risk of falls in such situation. Also, you need to advise the patient when they lie on the bed to avoid putting a pillow, say, for instance, in the total knee replacement, which cause and lead to permanent bent knee. Also encourage the patient to keep active and to keep mobile. Usually such joint replaced if there is long-term pain, decreased mobility, restriction of movement, pain at rest. So most of the commonest indication basically is osteoarthritis, rheumatoid arthritis, gout, and if there is knee injury, for instance, or hip injury, trauma, all of that could affect the joint. Also, to tell the patient to avoid driving for the first 6 to 8 weeks, as well as sexual activity and the work-wise. So you will give them a fit note and ask them to liaise with their GP if they needed the fit note for the work, or if they needed to extend it in that situation. About social life, you will you will give the same precaution and advice I just mentioned early on. And of course, you need to tell them if they were like sport people, so advise them to avoid any extreme movement or extreme sports. So by that, I hope, and also you need to tell the patient if they are a smoker, for instance, to avoid smoking, because smoking will affect tissue healing. And of course, avoid any too much drinking, and if they have any other coexisting chronic medical condition to be considered as well, like for instance diabetes or hypertension or heart disease or taking any other medication. So by that, I hope that I covered most of the important points that to be addressed in joint replacement, and I hope to see you in another podcast. Thank you.